Welcome to Medicine Handy Point. Today we will discuss chronic lymphocytic leukemia treatment and the treatment from the latest Cmdt book guidelines. So let's start. Now, usually chronic lymphocytic leukemia, there has to be some indication for the treatment because it is usually not treated. So the first indication is if there is evidence of bone marrow failure, which will be suggested to us by the worsening anemia or thrombocytopenia, or if there is progressive or massive enlargement of lymph nodes or spleen, or if the doubling of lymphocyte count in the blood occurs in 6 months. If there are presence of B symptoms, what are the B symptoms? B symptoms are fever, anorexia, weight loss. And if there is hemolysis or other immune-mediated cytopenia, because in CLL there is an autoantibodies production which can destroy the red blood cells and platelets. So if these are present, we can go for treatment. And in the last, if there are recurrent infections going on, we can also go for the treatment. So what are the treatment options? Let's discuss that. The first option is we got ibratinib. Now ibratinib is basically a Bruton tyrosine kinase inhibitor. We also have an option of venetoclax. This is a BCL2 inhibitor leading to apoptosis of the cancer cell. These can be used in combination with anti-CD20 like obinutuzumab. So these are the treatment options. In elderly, chlorambucil, usually in the combination of obinutuzumab, is used, and this has pretty good response. Other options are idelalisib and duilisab, but these drugs are associated with higher toxicity, so it's the last option. For autoimmune hemolytic anemia or immune thrombocytopenia, we have option of rituximab, prednisolone, or splenectomy. And as usual, if all the options are failed, we have the option of allogeneic stem cell transplant. So that these are the options which we can use in a patient with chronic lymphocytic leukemia. I hope you like the video and please subscribe to the channel.